Which of the following sentences use the word review in a clinically appropriate way? So there are four sentences here. All four sentences has the word review. Where is it used the most appropriately? So we have Priyanka who has joined. All right, so Priyanka, good evening. So this is the first question of the day.
Good evening, sir.
Yes. All right, so we have Ramya too who has joined. Hi, Ramya, good evening. So we have started with the, yes, good evening. So we have started with the quiz over here. Which of the following sentences use the word review in a clinically appropriate way? All the four answer options as the word review. The nurse will review the patient's recent blood work before the consultation. The doctor reviewed the restaurant before visiting the patient. We need to review the patient's favorite music to improve the care. I reviewed his walking style while walking to the ward. So there are three answer options which are very not formal. Okay, it isn't clinically appropriate, right? So the answer option is very simple over here, straightforward. The answer option is A, right? Okay, that was a relatively easy one, right? So now let's go to the second question. The second question is this: choose the option that best completes the sentence. So it's a fill in the blank question over here. The patient was prescribed antibiotics, but the doctor also advised him to dash his fluid intake. So here you have to give importance to this word. But is a discourse marker. It is a contradictory information signaling thing. So what will be the answer? The patient was prescribed antibiotics. Okay, so that we gave the patient antibiotics for treatment. But the doctor also advised him. So we gave him a treatment and we are giving an advice as well regarding his fluid intake. So regarding his fluid intake, what advice do you think we can give? Right? Okay, so we have everyone choosing the answer option C over here. Right, C is the answer. Because increase carefully if you're choosing, it does not make a meaningful sentence. And of course, eliminate we cannot use, right? Reduce and monitor. You can choose reduce to a certain extent, but the more appropriate answer will be C option. Right. So today I deliberately have given very easy questions because for the past few days I have been choosing very difficult questions. So I just make it quite easy today. Right. So the third question over here. The third question over here is which sentence correctly demonstrates the use of the word contraindicated? All right, so what is the answer? Okay, so everyone has chosen answer option A over here. Right, so answer option A is the answer. Contraindicated. Okay, contraindicated means what? It doesn't go along. So we actually, so the most common, so those who are a little bit thorough in pharmacology, those who studied pharmacology, you will know that every medication has a pregnancy category. Right, that is, this medication should, if it is mentioned, pregnancy category A, pregnancy category B, pregnancy category C. Okay, so if the pregnancy category is D or C, then that means this medication is completely contraindicated in during pregnancy. If it is pregnancy category A, then there is no contraindication. Okay, it is safe to be used. So contraindicated basically means is that if used together, there will definitely be a um, you know problem. Okay, so there is another word for it. It is also medical word only. So I'll just write it down over here. So for that, I need to give an introduction to one word. So it's called synergistic. Spelling of synergistic is synergistic. Yeah, it's Cinergistic. So this is a medical term. Okay, you can expect in reading and all. So synergistic basically means benefit. Okay, that is, see, bread and jam. Okay, bread and jam together, it is, it makes a very delicious thing. Okay, bread alone and jam alone is not good. So that is what we call a synergistic. That is, 1 plus 1 equals 2, and it is a good thing. All right, so for example, let's say that you are taking one particular medication, and along with that you're taking another medication, but there is a drug interaction, but it is not a negative drug interaction, it is a positive drug interaction. Okay, so for example, we will say, ginger and honey. Okay, so if you're sick, like a warm glass of water, and you add ginger and honey, so both of them together, it will become even more powerful. Okay, ginger is good, honey is good, but both taken in combination, it becomes an even more powerful thing. So that is what we call a synergistic. Right. Now the opposite of that is called antagonistic. Okay, antagonistic. This is also a medical term. Okay, so this is very much closely related to contraindication. That is, when we take one thing along with another thing, instead of the benefit, both of them cause a damage. Okay, so contraindicated thing. So when we take two things which are contraindicated, it is also called as antagonistic. Right. So just some additional information for you to keep in mind. Right. Now let's go to the fourth question. In the context, okay, context means in this particular situation, or in this particular theme or topic, that's the meaning of context. So in the context of hospital communication, what does escalate care most likely mean? So in malls and all, you have seen an escalator, right? Escalator means what? A staircase that goes automatically. So escalate. But in a medical theme, what does the word mean? What does escalate care mean?
Special care.
Yeah. Special care. Right. Good. So, A, B, C, and D, which do you think is going to be closely related to the answer? Right. So we have answer option C over here, and that is indeed the right answer, right? Escalator. Okay, so very good. Special care. Okay, that is the patient needs little bit more extra supervision, monitoring, observation. Okay, that is what we call escalate means higher. Right. Now let's come to the very fifth question, and then let's go and discuss the pain points of reading part B. What is the most accurate interpretation of the term baseline observations? in clinical documentation? Baseline. So just think about an ECG. So in an ECG, you have the graph, right? Up, down, up, down. So the baseline, that is the steady line, is what we call as baseline. So with that understanding, what is the most accurate interpretation of the term baseline observations in clinical documentation? So these are all medical terms you need to be comfortable with. Okay, so baseline observations. Okay, the most accurate interpretation of the term baseline. Okay, so base. So what's the meaning of base? So base means foundation. Okay, basics. Okay, so what is the meaning of a basic? Okay, basic means the beginning, the foundation, right? From the basics, you have to climb to the higher things. Okay, so that is what the meaning of basic is. That's the same meaning over here, baseline, the foundation line, the beginning, right? So the answer is basically not C option. It is actually B. Okay, baseline observation. That is when you bring a patient to the hospital. So when you bring a patient to the hospital, we will take their measurements, right? That is, we will take their temperature, we will take their blood pressure, we will take their oxygen saturation, we will take their pulse rate, we will take their respiration rate. Okay, so that recordings. Okay, so when the patient comes into the hospital, when the patient came to the hospital, that is what we call as the baseline demographic details of the patient. That is, when the patient came, the patient's temperature was this much, pulse rate was this much, heart respiration rate was this much, oxygen saturation was this much, BP was this much, right? And then we will treat the patient. Okay, then we will treat the patient and we will reduce the temperature to normal. We will reduce the pulse rate to normal. We will reduce the BP to normal. And we can say, okay, from the baseline, we have achieved this much of progress, right? So baseline, the basics, that means the first set of measurements taken before the treatment begins, right? So this is it's a medical term, right? So you have to be quite familiar when it comes to these type of terminologies, because see, today what we are going to do, today we are going to be discussing reading part B. Okay, so reading part B means what? Workplace documents. That is, in a medical clinic, in Revati Chinnu. Right. Okay, so over here, yeah, baseline. Okay, so baseline basically means, as I told you, the first set of measurements before treatment begins, right? So why are medical terms important? Because today we are going to be discussing reading part B, right? So reading part B are always going to be workplace extracts, okay? Short workplace extracts. So therefore, you can expect all these kind of terminologies. And if we do not understand the vocabulary there, then it is going to be a little bit challenging. Okay, so um, let's take few reading questions over here. So what will we take today? How about we take paracetamol overdose? Right, so let's first of all see what we can expect. Right. So as you can see over here, we have 6 questions over here, and all the 6 questions will be workplace related questions. Okay, extracts, short extracts relating to work of healthcare professionals. Right, and it can belong to many different professions, not only nurses, not only doctors, but for veterinarians, pharmacists, etc., etc. It will keep on changing. Right. Now, see the guideline. So, see, when you're working as a nurse in a hospital, you will be getting certain guidelines from the hospital. Okay, so that is a workplace document. Now, as you can see over here, we can see, okay, it is for a doctors. Okay, so when seeking consent for a post-mortem examination, okay, um, it is necessary. Okay, so this is a document over here, and that giving us information regarding that. Now, the purpose of these notes about an incinerator. Incinerator means what? A machine that turns everything to ashes. Okay, that is, we put anything into the machine will burn it and it will reduce it to ashes. That is what we call as an incinerator. And we have certain notes. Okay, notes over here. That is how to operate the medical equipment. Okay, that's a workplace document over here. And you can see it is, once again, it is a manual. Okay, so it is an instruction manual about spacer devices. Spacer devices, like respiratory problems, like when a patient is having respiratory issues and all, they use a device, right, to help with their breathing. Okay, like a tube. Yeah, that is what we call as a spacer, right? So that is a medical extract. Now you see an email. Okay, so when you're working as a staff in a clinic, in a hospital, in an establishment, obviously from your superiors, you'll be getting emails. So those type of documents also you can expect, right? And now you see over here about drugs over here. Okay, so regarding certain medications from a handbook. Okay, that is a certain information giving book regarding that, some information. So like this, you can expect 6 multiple choice questions. Each question will have one separate content over here. And your duty over here is to understand the question, understand what the question is asking you, okay, comprehend the question, that is understand the question, register the information to your mind, that is retain the information to your mind, and then with the focused intent, simply do not read the paragraph. The OET is not giving you marks for reading the paragraphs. The OET is not giving you marks for understanding the paragraphs. The OET is giving you marks for choosing the correct answer. So read through it. Again, the language over here is not very simple language. So some of the questions over here are extremely challenging. Okay, it is extremely challenging. So therefore, the language they use, the sentence structures they use, the vocabulary they use, the phrases they use are going to be very much advanced. Right. And because it is much advanced, simply reading it blindly is not going to help you out. It is only going to be a waste of time and waste of energy. So you must understand the question. You must have a thorough idea. Okay, this is what the question is asking me to find. And with that idea, with a focused intent, you should read the passage, try to understand it, do the keyword analysis, right? And then instead of choosing the correct answer, focus on eliminating the incorrect answer options. Right. That is what you need to do. Okay. There are so many strategies over here. We'll be discussing the strategies one by one. Okay. So the questions over here, sometimes I feel like, part B questions are more difficult than part C because, the language is very, very tough. I don't know which question to choose today. This has a lot of mathematics going on. Let me choose an easy one. Mm, Also a tough one. Okay, so maybe how about the second one? Okay, so the easiest one over here is basically the second one. All right, so I'll give you some time to read the question as well as the answer, as well as the paragraph over here. Okay, and try to do it and let me know what the answer is in the chat box. Here, the elimination strategy is the easiest strategy. So give importance to the verbs of the answer options. And once you give importance to the verbs, it will help you to eliminate the incorrect answer options. Choosing the correct answer directly is going to be tough. You have to be smart over here. Okay, so what is the answer? Is it A, is it B, or is it C? Okay. So let's take a look into the question, right? So we will be talking about certain strategies over here. Okay, so first I will just write down what we're going to talk about. So your duty, so once again, your duty is to not read the paragraph and not understand the paragraph. Your duty over here is to find answers to the questions, right? So the question is always the priority. So the first and foremost thing you should read is the question. So once you have read the question, then only you know, okay, this is what I'm supposed to find out. Your mind is telling you, this is what the OET is asking me to find out. And with that focused intent, you should go to the passage and try to pinpoint the correct answer. Right. So, comprehension of the question. Okay, that is understanding the question. That is important. And for that, you have to do the keyword analyzing strategy. Then comes retaining the question to your memory. Okay, that is registering the information to your memory. That is not forgetting what you understood. That is when you are reading the text, you are not reading to understand the text, you are reading to find the answer to the question. Okay, so the question's memory in your mind, you're reading the text. And of course, when you're reading the text, there also you have to do the keyword analysis. Okay, and again, then that is what we call as detection, right? And obviously, in this particular question, selecting the correct answer is not that difficult. It is selecting the correct answer is a little bit easy only. But the easier thing over here is to eliminate. Okay, that is instead of choosing the correct answer, it is eliminating the incorrect answer options, right? And the one strategy that will help you to eliminate the incorrect answer options is the verb analysis, right? Once you understand the verb analysis and once you understand the focal point of the question, that focal point will kind of help you to eliminate the answer options one by one. Right. So this and all is what we're going to be discussing today. And of course, when you're reading, quality of reading is more important. Okay. So that is when you're reading, try to understand because quality reading is important since the lot of synonyms. Okay. Synonyms will be used. Different sentence structures will be used, same meaning, but different sentence templates, sentence modifications will be there. So if a student is expecting the same words from the question to repeat in the answer options, it is not going to be easy. So quality reading, okay, that is instead of quantity, just writing quantity, okay. Quality reading over quantity. That is what, instead of reading it 2, 3, 4, 5 times, 2 times, if you're reading it for this thing, that's very important. And then elimination strategy and all. Okay, so again, everyone has their own style over here. So now let's take a look into the very first question. I mean, the second question over here. When seeking consent for a post-mortem, examination, it is necessary to. Okay, so when a patient passes away, okay, and when it is required that the medical staff conduct a post-mortem examination. Okay, that is autopsy. Okay, so that is another word for post-mortem. Usually in India only we call it post-mortem. Outside India, it is actually called as autopsy. Right. Autopsy. What is biopsy? There is another word called biopsy. What does biopsy mean? Biopsy means from a living patient, okay, or living patient, or that is we are taking one sample from the body, okay. Yeah, taking a sample, very good, right? That is, we are taking a sample from the body and we are sending it for testing, like, DNA testing or whatever it is. Okay, so the patient is probably alive. The patient is all, we are just taking one sample from the body and we are sending it to laboratory for testing. That is what we call as biopsy. Autopsy basically means the patient has passed away and we are conducting to find the reason for the death. Okay, that's the difference between autopsy and biopsy over here. Right. So when seeking consent, seeking means requesting. So in this situation, seeking means requesting. Okay. And consent basically means permission. Okay. So when we are requesting when we are requesting permission for autopsy, it is necessary, means it is needed. Okay. So here the focal point of the question will be what? It is necessary. So what is necessary? Okay, so answer option A is necessary. Answer option B is necessary. Answer option C is necessary, right? So these three answer options among one over here is necessary. So it is needed. Okay, A is needed, B is needed, C is needed. So our duty is to find what is needed, what is required, what is necessary, right? So like that, you need to understand the focal point of the question. Okay, once you understand the focal point of the question, it becomes a little bit more easier. Right. For this, you have to think very clearly. Now, let's do the keyword analysis of the question. It is necessary to give a valid reason for conducting it. Okay, so means just one. Okay, give a valid reason for conducting it. So what does the word it mean? The it refers to post-mortem examination. Okay, so here also it refers to post-mortem examination. Okay, this is what it means. So it is, so when we are requesting permission, okay, requesting permission from the relatives or the caregivers of the patient, it is important that we give the patient, okay, that is the medical staff should give, okay, what should they give? A valid reason. Okay, that is they should give a very strong reason for conducting it. Simply for no reason, for time pass, we cannot do this. So you have to provide them with a very strong reason that you have to convince them. This is the reason why it is required. That is what is needed in answer option A. Now, what is needed in answer option B? Okay, it is necessary to allow all relatives the opportunity to decline it. Okay, that is we are allowing, okay, we are allowing the relatives, that is each and every relative, okay, from the immediate family member to the distant family members, we are giving them the opportunity to decline autopsy. Okay, this is what answer option B is telling. Okay, now let's do the keyword analysis. Answer option C. Only raise the subject. Subject means what? Once again, this examination, post-mortem exam. That means subject means topic. Only raise the subject. Raise means what? Bring up. Okay, so only bring up the topic. Only talk about the topic of post-mortem after the death has occurred. After, that is, the patient has died. And only after the death of the patient has been confirmed, only then we should bring the topic of post-mortem. If the patient is alive, the medical staff should stay silent. He or she, the medical staff should not at all talk about post-mortem examination. Understood? Okay, so this is how we do the keyword analysis. Okay, so again, when your examination day, you have to do it much more quickly. Quality reading will help you do it much more quickly, right? So now let's do the verb analysis, right? So what are the verbs over here? The verb in answer option A. What is the action? Give. Okay, give is the main verb over here. Okay, so it is necessary that we give a valid reason for conducting it. So what should we give? A valid reason. Now, what is answer option B? What is the verb over here? Allow. Okay, allow all relatives to decline it. Okay, that is, we are allowing them to decline it. And then what is the verb in answer option C? Only raise the subject after death has occurred. Okay, so here we have two words over here, raising the subject. Okay, raise the subject over here after the death has occurred. Right. So like this, you have to do the verb analysis. So it is necessary to give a valid reason. It is necessary to allow medical relatives to decline it, and it is necessary to raise the subject only after the death has occurred. Right. So with this circulating in your mind, now what you should do, you should go to the question over here and you must try to find out what is needed. Okay, when the medical staff is requesting permission, what should they do? Right. So let's see what they have given over here. Post-mortem consent. Right. A senior member of the clinical team, preferably the consultant in charge of the care, should raise the possibility of a post-mortem examination with the most appropriate person to give consent. Now, here they have written a senior member. Okay, so this is the most experienced member of the clinical team, that is the medical team, preferably the consultant in charge, right, of the care, should raise the possibility, okay, of a post-mortem examination with the most appropriate person to give consent. Okay, the most appropriate person means the closest person to the patient, that is, who is having most authority over a patient. With that patient, with that person, we should go and raise, that is, bring up the possibility of a post-mortem examination. Now, this is answer option C. Okay, because what is answer option C telling us? Only raise the subject after death has occurred. So here we have we have read about raising the subject. Okay, this is mentioned. Okay, raising the subject is mentioned, but after the death has occurred, that we have not yet read. Okay, that is, they have not written that we must, talk about the possibility of a post-mortem examination only after the patient has died. This is mentioned. This is not yet mentioned. We have yet to read it. Okay, so let's continue to read the second sentence over here. The person the person consenting means what? The person who is giving permission. Okay, the person who is giving permission, right? That is the closest person to the patient, right? The person consenting will need. Now see, what does the person giving permission need? Okay, the person consenting will need an explanation. Okay, they need an explanation of the reasons for post-mortem examination and what it hopes to achieve. What does the word it means? It means post-mortem examination hopes to achieve. Right. So when we are going and when we are requesting permission for post-mortem, the person who is consenting, that is the person who is giving information, They need something. What do they need? They need an explanation. Okay, they need an explanation of the reasons. That is why. Okay, reason number one, reason number two, reason number three. For these reasons, it is very important that we conduct a autopsy. Okay, and also along with the reasons, we should also inform them what it hopes to achieve. That is, if we do the postmortem of this patient, we will achieve this knowledge. Okay, so like that, we have to convince the person. Now, what is, do you think we have read in answer option A? Now, in answer option A, see, it is necessary to give a valid reason for conducting it. So, what is the verb over here? Giving. Okay, giving. And what are we giving? A valid reason. Now, what is the same thing over here? See, they will need an explanation of the reasons. Okay, so here what you can do, you can put a question mark over here because the same, because you suspect that A could be the correct answer because the verb, the keywords, and the same meaning is coming over here. Now you see, this is the benefit of reading the question first, because when you read the question, sometimes now see, we have not yet read the full paragraph. Only the first two sentences we have read, but just by reading the first two sentences itself, we have almost suspected the correct answer. Right. So, like this, you will be able to save a lot of time. But if a student is not reading the question first, and if they're reading the paragraph, then when they read from here to here, they will have no idea that this is answer option A, right? So they will continue to read the entire thing, and like this they will waste some time as well as more energy as well. Okay, so reading the question definitely has an advantage first because that is your duty here. All right, so anyway, let's continue to read the next part. The first approach should be made as soon as it is apparent. Apparent means clear. CLEAR, clear. Okay, it should be as it is clear that a postmortem may be desirable, as there is no need to wait until the patient has died. Now, see, what are they telling over here? No need. Okay, there is no need to wait until the patient has died. That is, when the patient is alive. When the patient is alive, that time itself, we can approach the person who is consenting and make it very clear to them that the patient is still alive, but the patient may die soon. And if that happens, it is desirable that we conduct a postmortem examination. So here they're telling there is no need to wait until the patient has died. Now, see, what did we read in answer option C? Only raise the subject after the death has occurred. That is, we must only talk about postmortem once the patient has died. So that is extreme. Okay, that is an extreme contradiction of what we read in the passage. So here, without any doubt, you can eliminate answer option C. Okay, and you have suspected that answer option A could be the correct answer. Okay, and B, we have not yet read it. So it is either A or it is either B, but definitely not C. Okay, so like this on your question paper, you can put a question mark, you can put a cross mark like this and so. So like this, you can definitely interact with the question paper. Okay, so that will definitely help you out. Now let's go to the last sentence over here. Okay, now they're talking about relatives. That is B part. Okay, many relatives are more prepared for the consenting procedure. Okay, if they had the time to think about it beforehand. Okay, that is, they are telling they are more prepared. Relatives are prepared nowadays. Okay, relatives are prepared for the consenting procedure. That is, when a patient in a critical stage is brought to the hospital, they are prepared. They are mentally prepared. Okay, the doctor will come and they will ask about post-mortem consent. They are more prepared. That is what the writer is saying. Right. But what is the answer option B telling? What is the verb over here? Allow the relatives the opportunity, decline it. Okay. So this verb, okay, so allowing the relatives to decline it. So that is not mentioned. Okay, that is not mentioned anywhere. So what you can do, you can eliminate answer option B. Okay, the verb over here is not mentioned. Now here, this is mentioned. Raising the subject is mentioned, right? That is mentioned, but here they have written raise the subject only after death has occurred. That is a direct opposite of what we read in the passage over there. So it is never the right answer. So you can eliminate it. So B and C you have eliminated, which means by default, the answer is going to be A. Okay, so the confirmation, give a valid reason for conducting it. Okay, that they have clearly mentioned. That is what it hopes to achieve. and all that. So for that reason, answer option A will be the right answer. Right. So this is the strategy over here. Now you see, when a student reads the question first, okay, so a student has read the question, the memory of the question is very thorough in their mind. Now you see, when the student read the first two sentences, that is the first two sentences itself they read, the student is now able to say answer option A is the most is likely to be the correct answer. That is, they have not read the full text, but since they read the question, they're able to say, yeah, this is the correct answer. And then see, when they read this sentence, that is, there is no need to wait until the patient has died. As soon as they read this sentence, they will be able to eliminate answer option C. Right. Okay. And then the last sentence, when they read, they will be able to eliminate answer option B. So this is the advantage of reading the question first. But if a student is not reading the question first, if they're reading the text first, then what happens? Then they have to read the question, and then once again they need to come over here, and then once again they need to read it, understand it, and again there's a waste of time. So why waste time unnecessarily? Right? So that is the answer. Right. So now let's take a look into what taking. Okay. So has anyone? No one has attempted the answer. No. 56, 956. C. Okay, I think, yeah, A. Okay, if A everyone has chosen, right? A. Okay, okay, good. All right, so A is the answer. Right, but this is the method in which you must be doing. Okay, so luckily this is a easy one. How about we do a tough one? Okay, so now let's take a tough one over here. This is a little bit easy one. Mm, Spacer devices. Here there is a lot of mathematics involved. Do you want to do a mathematical question, or do you want to do a tough question over here? We do one thing. Okay, so let's test your mathematical skills. Okay, so this will involve a lot of numbers. You have to think, let some calculations and all, not too that kind of calculations, but some calculations may be necessary over here. Right, so the fifth question. So I'll do one thing. Just let me see if I can have two the same time. Okay, so is it visible now? No. Yeah. Okay, now it's visible, right? The question as well as the text is visible, right? Okay, so you can try to do the question over here. The email is reminding the staff about staff that. So this is answer option A, B, and C. And this is the passage over here. It's a different kind of question. Think very clearly. Huh? Right, so what's the answer? Here also the verb analysis will help you to eliminate the incorrect answer options. You have to trust your intuition. Trust your intuition to get the message. Okay, good. Let's take a look into the question. 1 second. Right. So, what is going to be our strategy here? Our strategy is always going to be reading the question first, because our duty here is to find answers to the question. So let's do that. So this is an email. Okay. So this is a workplace document. So an email is being sent. Okay. So the email is reminding the staff. So what is the purpose of this email? Okay, so we send an email for a purpose, right? Simply for no reason, we will not send an email, right? So the purpose of this email is to remind the staff. Okay, so it is reminding something. So answer option A, answer option B, and answer option C. What is the focal point over here? The focal point over here is the word over here is reminding. Okay, the email is reminding. So the email is reminding them about A, that is benefits. B, number of bed accident, answer option C. So all of these are basically reminders. Okay, so that is what. So when you're reading the text, you must try to understand, okay, what is the purpose over here? Okay, what basically is the email trying to remind the staff about? Right. So with that intention, you need to read. Now let's take a look into the keywords over here. Now, what is the keyword over here? The email is reminding the staff that the benefits to patients of using bed rails can outweigh the dangers. Now, what is the meaning of outweigh? The benefits, this I want everyone to participate, because this is a very, very common word, a very, very common word. I think in most language exams, this word has been used plenty of times. So everyone must know what is the meaning of outweigh. Benefits of patients using bed rails. Okay, bed rails means what? Like jails, like, bars. So have you seen like patients, they fall down. So to prevent the patient from falling down, in all four sides of the bed, there will be some bars over here, okay, that prevents the patient from falling down. That's what we call as bed rails. So what's the meaning of outweigh over here? Um, Avoid more benefits to patients of using bed rails can outweigh the dangers. Okay, more is mentioned. Okay, but can you in your answer, I want 3 words. Okay, I want everyone to write in their answer in the chat box. Benefits should be there, so this word should be there. Okay, because I want to see how many of you has understood the meaning of outweigh. Okay, benefits outweigh dangers. Okay, so here I'll just maybe type it over here. Benefits outweigh dangers. What is the meaning of this phrase? Benefits outweigh dangers. So in your answer, I want benefits and dangers to be mentioned. Outweigh is a figurative speech, huh? It is a figurative speech. It is not a literal word over here.
Actually, remove the patient from.
Mm-hmm.
It is beneficial to patient to remove from danger like that.
Close, close. To, but how can it was? Oh, okay. No, that the meaning has changed a bit. It is beneficial.
Helps you
Helps. It helps the patient.
to avoid
Mm-hmm.
dangers.
Okay. Okay, so in that there is so avoiding danger means there is no danger. Okay, so good. Okay, I'll explain the answer to you. I get your message. Okay, so let's see if anyone else is coming to the answer. So we have multiple
Like,
students. Yeah, I understood the point. I understood the point. I'll explain to you. That is, it is beneficial to prevent the patient from any dangers, right? That is to completely avoid the dangers. That is your message, no?
Yes.
Yes. Okay, that's a good attempt. All right, but I just want to see if there is anyone else. Come on, this is a very very common word. Here,
uh,
everyone.
it has advantages
Mm-hmm.
greater than advantage.
Mm-hmm. Yes. Okay. So you're talking about there are dangers, there are disadvantages, but the advantages are more. Okay. So we had two answers. Okay, both of them were very good attempts. All right. So if I'm going to like rephrase Revati's answer, Revati said it is beneficial to the patient to remove all the dangers. Okay, I think to avoid the dangers, it is, I mean, to remove. So in this particular thing, we are talking about one benefit. Okay, so there is just one benefit and there is zero danger. Okay, so this is okay. So that is also to avoid. To avoid basically means what? Avoid basically means there is no danger at all. Okay, that is the answer we got. Okay, so good answer. Okay, and then outweigh over here. So here, Reena actually mentioned that there is danger. Okay, there are dangers, then there are benefits as well, but benefits are more. Okay, so here she told like benefits are more than the dangers. So here, obviously, the number of benefits, the number of benefits. Okay, let's say it can be one, it can be two, it can be three. Okay, let's say it is benefits, right? So benefits basically means there should be more than one. So let's say there are two. Okay, and then the dangers are not zero. Dangers will never be zero because there should be at least one. Okay, so benefits outweigh the dangers. Okay, so here let's go to explain this, okay, to visually explain this because this is a very, very common point and it's very important that we get the answer. Okay, so both very good attempt. Now, have you seen in old movies or those who have old movies? No, I think you just think about your childhood. If you think about your childhood, when you go to a vegetable market, okay, when you go to vegetable market, and we say, I want 1 kilo carrot. I want 1 kilo what to call it, tomato. I want 1 kilo potato. There is no digital. Okay, there was no digital weighing machine back then. Right. Back then we had something like a scale. Okay, so there was a scale over here, and there is a scale over here, right? So what they will do, they will put like 1 kg tomato they will put over here. Okay, so let's say this is 1 kg tomato over here, right? Okay, so let's have 1 kg tomato here. So so many tomatoes, and here they will put exactly 1 kg weight. Okay, have you seen that 1 kg weight? So here if the same, so here if it is 1 kg weight and here it is 1 kg tomato, then the scale will be balanced. All right, the scale will be balanced because the weight is exactly the same. Right. Now, here, imagine another scale. Okay, another scale over here. Now, the vegetable person, he puts 2 kg. Okay, so he puts 2 kg weight over here. Okay, he puts 2 kg weight over here, and he puts 1 kg tomato here. Okay, so don't you think this is how the scale will be? Because this is heavier, right? The weight is heavier, the tomato is lesser, right? So this is what we call as outweigh. Okay, so this is a figurative speech. Okay, so benefits outweigh dangers basically means, okay, so the answer that came from Rina is little bit more appropriate over here. That means the benefits are more, right? The benefits are more. Dangers are there. There is danger to the patient, but the number of dangers is less compared to the number of benefits. So this is the meaning of outweigh. Okay, so that is what they're trying to say. So the OET people, they'll always try to trick you like this. So it is very important that we understand the meaning, because if we do not understand the meaning from the option, then no matter how many times we read the passage, we are going to get confused. Okay, so this is the meaning of outweigh. So proper vocabulary will help you out a lot. Right, so that is the keyword analysis. So benefits to patients of using bed rails can outweigh the dangers. That means using bed rails has both benefits, and bed rails also has dangers, but benefits of using bed rails are more. Okay, that is what answer option A is. Now, answer option B. Number of bed rail related accidents has reached unacceptable levels. Okay, so there is a number, okay, very huge number of bed related accidents, and this number has reached unacceptable levels. That is very, very high levels that we cannot how many patients are suffering because of bed related accidents. So it is becoming an alarming number. Right. Next is answer option C. Patient's condition should be central to any decision about the use of bed rails. Okay, so here they're telling central. Central means what? The main. Okay, the main decision. Okay, that is the patient's condition. Okay, the patient's condition should be the main thing. Okay, the condition of the patient. Okay, the condition of the patient should be the most determining factor to take a decision about the use of bed rails. That is when we want to take a decision. Okay, we have patient number 1, we have patient number 2. So should we give patient number 1 a bed rail? So what is the central factor? That decision to give the patient a bed rail depends upon the condition of the patient. So the situation of the patient is the determining factor. Right. So like this, we have done the keyword analysis, but let's do the verb analysis now. Right. So verb analysis, answer option A. Let's do the verb analysis over here. Benefits to patients of using bed rails can outweigh the dangers. Okay, so here we have this is a verb over here, using bed rails can outweigh, but I would say this is a little bit more appropriate verb. Okay, the main verb is outweigh. So the email is reminding that the benefits can outweigh the dangers. So that is the answer option A. Right. Now let's do the verb analysis of answer option B. Number of bed-related accidents has reached unacceptable levels. Okay, this is the action, right? The number of the statistics have reached a very high number, and it is unacceptable. That is, that many patients are suffering because of this. So the email is reminding them about that. Right. Now let's come to answer option C. Patient's condition should be central to any decision. Okay, so taking any decision, that is the action over here. Okay, so the email is reminding them, if you're going to decide to use a bed rail, you have to always give importance to the patient's condition. Right, so like this, we have the verb analysis done. Now let's take a look into the this thing over here. So we have the memory of the question. What reminder message is given to the patient over here? Right. To all the staff, subject, use of bed rails, please note the following. So now let's try to read it. So again, this is an email. So let's think about the email. Let's try to think why this email was written. Okay, so you have to think from the person perspective of the writer also to get the maximum idea. Patients in hospital may be at risk of falling from bed for many reasons, including poor mobility, dementia, delirium. Delirium means, confusion, head spinning, visual impairment, and the effects of treatment or medication. That is side effects. Bed can be used as safety devices intended to reduce risk. Okay, so here the answer option, I mean, the first paragraph over here is telling patients in hospital are a very great risk of falling. Okay, they are at a very great risk of falling from the bed. The reason for that is because of poor memory, poor mobility, dementia, delirium. Okay, so there are many reasons why. So for all these reasons, they are a very great risk of falling. And to prevent it, okay, so prevent it, bed rails can be used as safety devices. So what are bed rails? It is basically safety devices intended to reduce risk. Intended means intention. So the main reason, the main purpose is to reduce the risk of patient from falling down. That is the first message over here, right? Now let's go to the second paragraph over here. So this is where a lot of numbers and mathematics is coming. So here you have to make sure that you're understanding it in detail. However, okay, now you see, however means what? That is also a discourse marker, right? That is, it is signaling a change. So in the first paragraph, what we read, bed rail is a good thing. Bed rail is a safety device. Now, the word over here is however. So when you hear the word however, now you can expect a negative information coming. Here is a positive information about bed rails. Now the however is signaling a negative information. So let's see what is the negative. That is, even before reading the sentence, just by catching the word however, you must be able to say, okay, now a negative information is going to come. Right. However, bed rails are not appropriate for all patients. So just because it is a safety device, it is not appropriate for each and every patient, and their use involves risks. So it has benefits, but at the same time, it has certain risks as well. Now there is a statistics. Okay, so this is where things get little bit challenging. National data. National data means just one country. International means more than one country, multiple countries. National means just one country. Okay, so in one single country, national data suggests around 1,250 patients injure themselves on bed rails annually. Okay, so quarterly means what? 4 months. Annually means what? 12 months. Okay, half yearly means 6 months. Okay, so here every 12 months, that is every single year in one particular country. So that is the meaning of national data. It is not worldwide data. In one single country, almost 1,250 patients injure themselves. Okay, that is the patient. No one is injuring the patient. The patient is injuring themselves on bed rails every 12 months. Okay, usually scrapes and bruises. Scrapes means what? Small scratches, and bruises. Bruises means small hits. Okay, to their lower legs, especially to the lower legs. So this is the risk factor over here. So we understand that. Now let's see what is the statistics showing. Statistics show 44,000 reports of patient falls from bed annually, resulting in 11 deaths. So this is bed rails. Okay, 1,250 patients injure themselves in bed rails, but here 44,000 people fall from the bed. That is, they are not using bed rails, and this many people, they fall from the bed annually, and here 11 deaths are happening. 11 deaths because bed rails are not used. Okay, and 44,000 people are getting injured. But here you see the email is telling, if we are using bed rails, 1,250 people, they injure themselves, but the damage is very small things, very small bruises and very small scrapes to the lower legs only. But here, without a bed rail, it causes 44,000 people to fall from the bed, and even 11 deaths. And this is every single year. Okay, while deaths due to bed rail entrapment occur less than one every 2 years. Okay, so while deaths due to bed entrapment, that is, we have given a bed rail to the patient. Okay, the patient gets trapped. For some reason, the patient gets trapped in the bed rail, and that type of death also has happened. That is, but every 2 years, less than one death. Okay, here every year 11 deaths are happening. Here every 2 years, less than one death is happening. So see, when we're talking about statistics, see, is it impossible for 0.1 percentage of a person died? See, less than one means what? So you really have to understand the less than one. What is the meaning of less than one? Less than one means it can be 0.5. Okay. So what is the meaning of 0.5 deaths? Can a person die 50 percentage? 50% of the body is alive, 50% of the body is dead. Can we say that 0.5 death? So what is the meaning of less than one death? Okay, so usually in statistics, when the number of deaths is very, very low, that is every 2 years, we say less than one death. Okay, that is not just maybe maximum one person dies every 2 years. Okay, so but in the case of statistics, it is very much possible to write like this. Okay, so don't get confused when you hear less than one death every 2 years. Right. And are avoidable. So here the thing, and it is avoidable if the relevant advice is followed. Okay, so and if we are following the correct advice, then this death also, that is every 2 years, only one death is happening, less than one death, that can be avoided. That can be avoided if we are using the correct advice. Right. Staff should continue to take care to avoid better entrapment. So here they're saying staff should continue. Okay, they should take very good care to avoid betrayal entrapment, but be aware. Okay, so see, they should be careful, but be aware that in hospital settings, setting means situation. In hospital situation, there may be a greater risk of harm to patients who fall out of bed. So see, what is the last sentence over here telling? The last sentence over here is saying in a hospital. Okay, that is bed rail. You giving patient a bed rail. Good thing, but you have to be careful. Okay, this it is telling the patient, telling the staff, you should be very careful if you are giving a bed rail to the patient. Now see, but over here means what? So this is a negative word. This is a negative information, right? Staff should continue to take care. That is, it's a negative information. That is, you should be very, very careful when we are giving, bed rail equipment. Okay. Now the word but is coming. So from negative, now it is going to become a positive word. Okay. Now what is the positive information coming? But be aware. Okay. That is, be knowledgeable. Understand that in hospital settings, there may be a greater risk of harm. Okay. That will be more harm to patients who fall out of bed. Okay. That is, if the number of harm, the damage is more. The damage is more to patients who fall out of the bed, whereas the damage is less. The damage is less if it is within the bed rail. Okay, entrapment. So when you are reading, so this is an inference type question. So almost an inference type question. So here you have to read the entire thing and you have to reflect on it. Okay, reflect on it and come to your own conclusion. Okay, you have to trust your instincts and you have to like ask yourself, okay, what exactly? So what purpose is the email trying to tell us? So here the answer specifically is not mentioned anywhere. It is a reflective question. Here you have to reflect for the answer. Right. Now answer option A. What is answer option A telling? What is the verb over here? Benefits to patients of using bed rails can outweigh the dangers. That is, there are dangers and there are benefits, but benefits are more than the dangers. Now, don't you think that is mentioned several times over here? Now, see, here, the first proof, the first evidence is only 1,250 patients injure themselves on bed rails. But without a bed rail, 44,000 patients fall. Okay, so see, there is a number difference. Okay, the risk is more, the damage is more without a bed rail. Now, see over here, without a bed rail, 11 deaths are happening, but with a bed rail, less than one death every 2 years. So here also they are telling there is risk and there are benefits, but the benefits are more. Okay, people who do not use bed rails, the risk is more. Okay, 44,000, 1,250, 11 that's less than 1. So you see the math over here, you see the mathematics, which is more and which is less. Okay, benefits are more, okay, than the dangers over here. Now you see the last word over here, the last sentence also. Okay, be careful when you're using bed rail. Okay, but there is a greater, here they are clearly mentioning greater risk of harm. Okay, without a bed rail. So without a bed rail, the risk is much more, the danger is much more. Right. So here very clearly they are telling. So when we have gone through all these things, you can see the word, okay, outweigh. Okay. The benefits outweigh the dangers. Okay. So that is what is continuously repeated. So from the statistical data to the end of the information, the repeated information is that. Okay. Number of risk is more. The number of risk is more, and without, that is, if you're not using bed rails, the risk is more. If you're using bed rails, the risk is less. That is, the benefits are more. Right. So what you can do, you can put a question mark over here because you suspect A to be the correct answer. Right. Now let's come to answer option B. So what is the verb over here? Number of bed rail related accidents has reached unacceptable levels. See, what is the verb over here? Okay, reached unacceptable levels. Now, bed rail related accidents. How much was the bed rail related accidents? 1,250 only. Okay, only 1,250 per year. All right. And what is the death rate? Death rate is less than 1. Less than 1 every 2 years. Okay, less than 1 every 2 years. So do you think we can say that the number of bed rail related accidents has reached an unacceptable level? Absolutely not. This is not at all mentioned anywhere. In the paragraph, we read without using bed rail, 44,000 deaths are happening. I mean, injuries are happening. 11 deaths are happening every single year. But the verb over here is it has reached unacceptable, that this is completely unacceptable. We cannot continue this. Is this verb mentioned anywhere? That verb is not mentioned. Okay, so since it is not mentioned and number of bed rail related accidents are very less, the number of bed rail accidents is mentioned. Okay, but it is very less. As you can see, just very tiny number only. It is not an unacceptable number. Okay, so for that reason, it is completely incorrect. So we cannot eliminate answer option B. Right. Now, what is the verb? So here also the verb analysis. What is the verb in answer option C? Patient's condition should be central to any decision about the use of bed rails. So here, what is the verb over here? Taking a decision. Okay, that is, we have patient number 1, we have patient number 2. Okay, and we want to give the patient a bed rail. But for that, how to take the decision? So here, to take the decision, we have to give importance to the condition of the patient. So depending upon the condition only, we need to give, we need to take a decision. Now see, patient's condition is mentioned over here. Okay, what are the conditions? Poor mobility, dementia, delirium, visual impairment, treatment, medications, okay, side effects and all. So yeah, patient's condition is mentioned. Okay, the different conditions over here are mentioned, and they all need a bed rail, right? But what is the verb over here? The condition of the patient decides the decision factor. Is this verb mentioned anywhere? That is, we always have to give importance to the condition, and only based on that, we have to take the decision over here. That they have not clearly mentioned. That this factor is not mentioned anywhere, right? So since that particular verb is not mentioned, that is, we have to always give importance to the condition, and that determines whether or not we should give a bed rail. So that is not mentioned. So C, you can eliminate. And as I told you, number of bed related accidents reaching unacceptable level, that is also completely wrong. So by default, and this is something that we see throughout. So again, when you read the entire email over here, repeatedly, the email is reminding the staff, you see, this is very less, this is much more. Okay, so bed rails are very good. Bed rails are dangerous. It is causing less than one death every year. But patients who fall out of bed are at more harm. Okay, so when you analyze it like that, your mind will tell you, okay, fine, I'm getting the idea over here that answer option A is the more right answer, and you can choose A as the right answer. Right. So here the trick over here, once again doing the keyword analysis, reading the question, understanding the question properly, understanding the focal point of the answer options, and then going to the passage and yeah, trying to understand, okay, what is the reminding, what information is given repeatedly, what information is given to the patient, to the staff over here, right? And then you kind of have to like link the verbs together and see whether this verb is mentioned, whether this verb is not mentioned. And this is basically an inference type question. That is, after reading it, you have to reflect back. You have to reflect back and you have to think, okay, what is the reminding factor? And then you have to like go back and forth. So sometimes you have to go back and forth. Okay, B, is B mentioned anywhere? That is, bed related accidents reach unacceptable. So you have to come. So here, are they telling that bed rail accidents have become unacceptable? No, it is not mentioned. So you can put a cross mark. You can eliminate that. Now, what is answer option C? Condition should be central. The patient's condition will decide everything. So is that mentioned? So here the verb is this one. So once again, so you read it. Okay, decision factor is condition of the patient. Depending upon the condition only, we can give the patient, we can take the decision. So that is the verb over here. Now you see, you're not trying to understand the meaning. You may not be able to understand everything that is given over here, but at least you can understand the verbs, right? Okay, the verbs you can understand. Okay, the verbs you can understand, and that you can keep in your memory. And now you come over here and you very smartly, you go through and you see whether you're able to locate the verb and add a verb mentioned here or not. And obviously we can't see that. But what is the verb over here? Benefits outweigh the dangers. Obviously, you need to understand what's the meaning of outweigh. Okay. And then you see, okay, is the outweigh over here? Yes. Okay. Without bed rails, this much death. With bed rail, only this much. So therefore, the risk is less, the benefits are more. Okay, benefits of using. And the last sentence also they're saying, so that is the verb over here. Okay, greater risk of harm to patients who fall out of bed, so benefits are more. So that is the verb over here, and you're getting the idea. So you can choose the answer option A. Right, so part B questions, even though it looks very innocent, okay, it looks very innocent on, just one tiny paragraph and one small question and only three answer options. But whereas part C, we have four answer options. So many people think that part B is easy. Okay, but again, sometimes I actually feel part B questions are more complex because there is no continuation. Part C, at least you have a continuation, like it's a very long passage. All the 8 questions are related to each other, but here everything is completely different. No connection is there, so it adds to the difficulty level. It's a workplace extract. Right. So this is how you can find the answer to the fifth question. Right. So again, it's pure hard work. Okay. I am, if anyone is over here expecting some tricks, you do this trick, you will be able to get the answer. No. Okay. It doesn't work. Okay. It is an international examination, Cambridge University. Okay. International doctors, nurses, all the medical professionals writing this exam. It cannot be an easy question. Okay, not easy, it is challenging. Okay, you have to accept the fact, you have to accept that the OET is challenging, and you have to be very smart about it. Okay, yeah, and just do the best you can, understand your strengths, understand your weaknesses, and just refine these skills: the verb analysis, the keyword analysis, thought clarity, the vocabulary, the phrases, the figurative speech, inference type questions. Okay, like that. Refine the skills through consistent practice. Right, so the recorded lectures are completely available in the app. Just open the app, log into paracetamol overdose part B, the fifth question. So here, there in detail, like, with photos, images, animations, and videos, and, translations in Indian languages. I have given you the very detailed recorded lectures over there for all the 42 questions. So, go through the lectures, make some notes, right? That will definitely help you out. Right. So let's have a small recap of what we discussed today. Right. So part B questions are always going to be workplace related questions, right? Workplace related. Okay, there will be 6 questions over here. All the 6 questions will be unrelated, right? And our duty here is to prioritize the questions. Okay, do not prioritize the paragraphs over here, because if you prioritize the questions, sometimes the answer will be in the very first sentence. Okay, so we did one question, right? The answer was in the first 2 sentences itself. So in those cases, you can save your time. Okay, you can save your time and you can save your energy as well, because you have read the question and you have already found the answer, okay, by reading the first 2 sentences. So the remaining 2 sentences, there is no need for you to put too much of time and energy. Okay, so you'll be able to save your time and energy, right? And then again, you have to follow the comprehension, right? Followed by retention, and then comes detection. Okay, that is your reading with a focused intent. Okay, that is, you have to understand the question to your mind, you have to have the memory of the question. Okay, and then with an intent to find the answer, you have to do it. And then, like the elimination strategy. So in order to eliminate the incorrect answer options, what is required? It is required that you understand the verb analysis, right? You understand the verb analysis, and accordingly you eliminate the incorrect answer options one by one. So always focus more, do not try to choose the correct answer, because that is not always going to work, especially if the answers questions are a little bit complex. Okay, the language over here, actually there are even more difficult questions here. I do not act, this is a relatively easy question. 1 or 2 questions are much more complex that we'll be discussing the later on class, or you can just watch the recorded lectures in the audio. So the elimination strategy is very important. And again, thought clarity. Okay, you must have a very clear mind. Okay, it is very important that you have a very calm, composed, rational mind, and doing it. Okay, so anyway, you have 45 minutes. Okay, you have 45 minutes to do part B questions, right? And part B, part C1, that is extract 1, and part C2, that is extract 2. Okay, so you have 45 minutes. So in part B, there will be 6 questions over here. All right, and you can give 15 minutes. 15 minutes for part B questions, right? Next comes part C1. Part C1, there will be 8 questions over here, right? There will be 8 questions, and you can give 15 minutes for part C1. Similarly, for part C2, right? The ultra maximum that you can give is, for 8 questions will be there. You can give about 15 minutes, right? Or else, if you're a little bit more concerned about part C, you can give 16 minutes over here, and here you have to like do it in within 13 minutes. So that is also completely fine. Okay, so that leaves you with what? 2 minutes per question. So that is, you can spend approximately 2 minutes per question, per multiple choice question, no more than that. So if a question, like, after 1.5 minutes or after almost 2 minutes itself, if you're unable to find the answer, skip it, go to the next question. Do not stay fixated on that one particular question, because see, if you get one answer option wrong, so let's say you're in the 5th question over here. The fifth question over here, it is taking you a lot of time. The 5th question, it is taking you more than 2 minutes, or even 2 minutes has gone by, and still you're not able to find the answer to the 5th question. Don't spend the 3rd minute and the 4th minute on it. Skip it. Temporarily, you skip it and you go to the next question, right? And try to find the answer within 2 minutes. So maximum 2 minutes you have to give you. And then the difficult questions. Okay, so imagine that you have done all the all the easy questions, and you have the 5th question. The 5th question you temporarily skipped. You skipped it temporarily, right? Now towards the end, you should come and you should do the difficult questions, right? So what am I trying to say? I'm trying to say that you should do the easy questions first. Okay, that is, there are 22 questions in part B and part C combined. All the 22 questions are not going to be same difficulty level. right? Not going to be of the same difficulty level. Some will be easy, some will be very difficult. And the OET people will never tell you when the difficult questions are going to come. So when a difficult question comes, it may look very innocent, it may look like very small and tiny, but however, it can become a very time consuming question. But even after 2 minutes, if you're not able to find the answer, skip it, go to the next question. So this is what we call as managing your time very cleverly. Time management is very, very important. And then once you have done all the easy questions, right, towards the end, you can do the skipped questions. So at least your mind will be very relaxed. Your mind will be happy. Okay, I have done my best. I have found the answers to the difficult questions. And with a little bit more relaxed mind, you can do the difficult questions. But on the other hand, if a student is going in the same exact order, okay, the same exact order by spending 2 minutes, 3 minutes, 4 minutes on one question, then what will happen? The student will run out of time. And then towards the end, the student will have maybe 5 minutes, and then there will be 4 or 5 questions left. Okay, so within 1 minute, they have to find answers to each question. Right. So they will enter into panic mode, and all the 5 questions will be easy questions. But because of their panic, because of their panic and anxiety, they will not be able to pinpoint the correct answer. Okay. So like that, you have to be a very good strategist. Right. So very importantly, you repeat. Okay. So these type of questions and all, there is no harm in repeating once and twice and all. You can constant repetition, understanding, thoroughly understand the material, and then you move on to the next material. Right. So this is what we can talk about in listening, reading part B. Right. So that being said, I think we can wind up today's session, right? Okay. So the assignment over here is to do a reading part B, take printouts, log into the app. All right. If there are any difficult questions, you can let me know through WhatsApp and all. You can always reach out to me. I'll try my best to reach out back to you. And in class also, we'll be covering like this. Right. So yesterday's class, we talked about listening part A, today reading part B. So tomorrow will be listening part C. Right. So practice, practice, practice. Reach out to me. Those who are attending the speaking and writing classes also, make sure that you are attending the classes, and you're sending the writing for corrections, speaking and all you're doing, right? That also. Okay, so I think we'll wind up the session. So those who are writing the exams next month, be very smart. Okay, I know that Reena and Priyanka, that you're doing the best you can. You have exams coming up, right? And I know you're all very busy as well. However, again, be very smart in your preparation. It doesn't matter that you have to spend 3 to 4 hours for your OET. If you're able to spend only 40 minutes for OET, that is also completely fine. That commitment factor is the most important thing, but work smart. Okay, like this, work on your skills. Okay, skill enhancement is what you need to work, and also keep your mind very calm as well. Right. So everyone, thank you for logging in. Right. Wish you a very pleasant evening. Right. So we'll see you in tomorrow's class. All right. So wishing you all the best. Right. Yeah. Thank you then. Okay. Bye bye. Take care.